Thank you, Mr. Chairman. This is a great discussion this morning. I'd like to thank the chairman for scheduling this hearing, thank the witnesses for being here. I'd like to thank the ranking member and other members from the other side of the aisle for some of the comments that they've made in regards to the common ground that we have on these issues. I think we're all interested in ensuring that every American can access the great healthcare system that we have here. We have differences about how we can best deliver that, but we have great discussions here today about potential solutions. And I'll use the term that the Democrats are often fond of, universal health care. I'd like to see universal health care. To me, that means that everyone can manage their health care expenses by having access to insurance if they want that access to insurance, and hopefully at a price that they can afford. We believe it can best be done by competition among providers and competition among hospitals, competition among insurers. And we think a system with that in place will deliver the best chance of ensuring that access. I ran about a 200-employee construction company, self-insured, and you've all talked about the benefits of self-insured, some of the problems with the red tape around that, the flexibility that can provide. And so I just want to mention the benefit that I saw of also creating partnerships between employers and employees to improve health care or improve health of employees and reduce costs. There was a shared risk in that. And then I've seen telehealth in my district. I've heard some of the concerns about telehealth, and it's the first I heard some of them, because I've always seen telehealth as being sort of better access to health care, part of a larger system, and literally helped to improve outcomes because patients tended to go to a doctor sooner and maybe take care of a health problem before it became larger. But I've also seen, and I want to ask this question, maybe Mr. White, I'll ask you, we have some very innovative systems by employers in my area where telehealth is part of it, but also then direct primary care. And this is where there's a sort of a monthly fee to a doctor that is then on call for employees. And even groups of employers are doing this at times. And people love it because they can call rather than missing work, having to go a distance. They can do telehealth, and then sometimes the direct care provider will even be on site if it's a large enough company. I have a bill that would help to, introduce it with Mr. Blumenauer, Democrat from Oregon, but essentially would ensure that employers who have access to direct primary care would also have access to HSAs, and they would be covered in HSAs. So Mr. White, are you familiar with that? And do you like it? And if so, how could we expand direct primary care?
It's a great idea. I love it. I think it expands options for workers to be able to access care on demand. It's kind of like the old concept when the doctor would come to your home, right? And you'd kind of,
it's like a family doctor.
And you'd get their attention and their time. And that's what direct primary care seeks to offer is that direct attention, that direct time dedicated to that worker so that they have good access to care. I think coupling it with HSAs makes a lot of sense so that people can pay any of their cost sharing obligations. And then on the telehealth side, I think one of the things that we've seen during the pandemic is really a focus on behavioral and mental health issues. And really,
absolutely,
90% of those claims on telehealth.
I want to get to one additional question, and I'm really sorry to cut you off, but Ms. Strauss, you'd mentioned site neutrality payments. And I've heard from this on sort of both sides of the issue, if you will, independent practices who literally have gone out of business because they've been bought up by hospitals that then could charge higher prices. And it's it's a system that we have in place that I think encourages that kind of consolidation, which I think then reduces competition. On the other hand, I have great hospitals in my area who argue that they face unique circumstances that justify the increased price of services. And I'd just like you to address that. Like, how do you talk about that? How do you respond to hospitals that are arguing that those higher prices are justified?
Yeah, and I'm definitely not arguing that they're not seeing increased prices. Everyone in the country is experiencing increased prices across the board. So I think what we want to get to is an easier, more transparent system so that if you are having a lab test in one clinic and the same exact lab test maybe at a different facility, that it should be the same price. We had a member that came forward in Indiana, and he and his wife both had exactly the same lab test. One had it at a clinic, one had it more through a hospital setting. His was $900, hers was $90. So we need to make sure that we know that the price is the price. That type of a thing should not be different. Where we're also seeing some challenges are those facility fees. So in some of those smaller clinics, now we're starting to see a facility fee be added on top of services that really there should not be a facility fee charged on. So we recognize our hospitals are also struggling. We are doing everything we can in the state of Iowa to make sure that all of our rural hospitals are getting what they need. Another piece of that is the Medicaid and the Medicare market. The reimbursements are not great, and so the private market literally holds them up. And so I've actually had a client who is a mental health provider, and she was contemplating lowering the amount of patients she was seeing in Medicare and Medicaid just to keep their doors open, and it was a heart-wrenching situation for her. So reimbursements across the board, we need to get that figured out so that it's fair for everybody.
Thank you. Thank you, Mr. Chairman.
Thank you.